બીજા ઘણા આપણને સારી રીતના કહેવાય એવા છે, પણ આપણે આપણા શરીરનું કઈ રીતના ધ્યાન રાખવું એના માટે ફર્સ્ટ ટાઈમ છે. તો તેઓ આપશે આપણને આજે ટોક ઓન નેક અને બેક પેઇન, અને આજનું ટાઇટલ છે બેક એન્ડ નેક પેઇન વોટ યોર જીપી વિલ નોટ ટેલ યુ. એટલે આપણે જીપી પાસે જાય તો આપણને દવા આપે, પણ આ જે આપણને જે ટોપિક છે એ ખરેખર તમને બધાને બહુ ગમશે. આજનો પ્રોગ્રામ તો આપણને બધાને લાગુ પડે છે, no matter what your age is. Many times we suffer and we take medication, but it takes a long time. This is going on to make a difference and leave an impact for the promotion of natural healing from within. તો હું તમને જરા આપણા આજના ગેસ્ટ છે, એમનું નામ છે ત્રિશુલભાઈ વાદી. તો હું તમને જરા એમના વિશે કહીશ. Trishul Vadi, from since a young age, એટલે કે સાવ નાની ઉંમરથી એમને ઇન્ટરેસ્ટ હતો અને એમને પેશન હતી કે માણસોને કઈ રીતના હેલ્પિંગ people improve their health and well-being. This has been the driving force for his obsession with searching for the world for the latest techniques and practices. As just one of the three practitioners in UK qualified in both osteopathy and chiropractic. ખાલી 3 વ્યક્તિ જ એવા છે કે એ લોકો કાયરોપ્રેક્ટિક અને ઓસ્ટિયોપેથીની અંદર પ્રોપરલી ટ્રેન્ડ છે. તો Trishul is one of the UK's leading practitioners in drug-free neuromusculoskeletal treatment and runs AVID Clinic in South London. In 2006, Her Royal Highness Princess Anne awarded Trishul with his Bachelor's of Osteopathy degree from University College of Osteopathy in London, and in 2012 achieved a Master's in Chiropractic from Macmillan College of Chiropractic in Oxford. Trishul has been interviewed on international television, at a royal wedding, published articles in professional magazines, and spoken at hundreds of events internationally on his expertise. With over 130,000 followers on social media, Trishul is here to make a difference and leave an impact for the promotion of natural healing from within. આપણે અંદરથી જે રીતના આપણને કઈ રીતના હીલ થાય એના માટે આપણને બધું કહેશે. તો હું આજના મહેમાનનું ઇન્ટ્રોડક્શન મેં તમને કરાવ્યું, અને તેઓની સાથે છે એમના વાઇફ કોમલબેન. તે તમારા ક્વેશ્ચન્સ જે હોય એ લેશે અને એન્સર કરશે. તો જેને કોઈને જો કંઈ ક્વેશ્ચન્સ મૂકવા હોય તો પ્લીઝ યુઝ ધ ચેટ, અને જેટલા બનશે તેટલા એ લોકો એન્સર્સ આપશે. તો તમને જરા તેમને વિશે બધું મેં કહી દીધું, પણ નાઉ will you all please welcome Dr. Trishul Vadi. Trishul bhai, the platform is all yours. Thank you.
Thank you very much for that very kind introduction, and I hope this talk today is going to be interesting and fun for you. આપણે અમુક વાર હેલ્થની વાત કરીએ તો આપણે બહુ સિરિયસ થઈ જાય, અને આપણે સિરિયસ થઈ જાય તો આપણું આમ થાય કે આપણે થોડાક બહુ ફોકસ કરીએ, બહુ ટેન્શન લઈએ, પણ આપણે છે ને આજે ઇવનિંગના મજા કરશું as well. We'll have fun with this because laughter is the best medicine, and I find that the best combination of getting the best health is to make sure we have fun with it. So please make sure you utilize my time with you today, and it's only an hour and a half. For me, that's not a long time for spending time with you guys. So please do ask any questions as we go along. Komal, my wife, knows me very well, so she'll interrupt me as we need to answer any questions. So please do utilize me. What I'm going to do first of all is share my screen with you so you can see the presentation I want to share. So this is me. I'm Trishul Vadi. I'm an osteopath and a chiropractor. Osteopathy and chiropractic are two different professions, and I'll explain to you the two different professions, how they work and why they're different, but what the similarities are, and how you can benefit from them, and how you can get the best out of this to benefit your health, your lifestyle, your well-being, not just for yourself, but apra family mate, apra loved ones mate, and how we can do all the things we want to do together. This is just an example કે અમુક વાર આપણે હું વાત કરું કે ઓસ્ટિયોપેથીનું કે કાયોપ્રેક્ટિકનું કે ની પેઇન હોય, હિપ પેઇન હોય, બેક પેઇન હોય, તો અમુકને થાય કે ઓ ખાલી જે મોટા ઉંમરનો હોય ઓલા કામને જ માટે હોય. Actually, this is only a handful of photos of some of the lives that I've touched over the years. I've been doing this for like 15 years. So I've been doing this for 15 years. I'm new at this. No, that's a joke. I'm not that new. But the point is that we help lots of people of a variety of different ages, different backgrounds, different careers, whatever it might be. So this is just to demonstrate to you, we've got right the way from children all the way to adults as well. So you'll find out how we can help you with this too. And now also what I've been really excited about is being able to share my knowledge, not just with people like you, but મને છે ને અમુક ક્લિનિક્સ બોલાવે, અમુક પ્રોફેશન્સ બોલાવે ને હું લોકોને શીખવાડું કે હું કેવી રીતના રિઝલ્ટ્સ મારા પેશન્ટ સાથે કરી શકું ને એ લોકો કેવી રીતના પણ એ એક્સપર્ટીઝ મારો લઈ શકે, and they can share it with their patients as well. So I do a lot of teaching like this. I also treat a lot of patients. So we see thousands of patients here. And I've gathered a wealth of knowledge and information over the years, so I'm here to share as much as I can with you today. Like I was introduced with, this was something I was really fortunate about, I was very proud of, that I was representing the entire profession of osteopathy at a royal wedding in 2018, and I was interviewed live on international television by Lisa Snowdon there on the royal wedding as well, and it was actually really fun and exciting. So I'm very proud of this moment, and they actually said that I was one of the leading clinicians to share on that platform. So really, as much value કે મને તમને આપું છે આજે, please make sure કે whatever તમારે જે specific personal professional health professional હોય, તમને જે તમને દવા આપી હોય કે advice આપી હોય, એ તમે પહેલા સાંભળવાનું. આજે I'm just trying to give you some education, just some ideas, a different way of looking at things, a different consideration. And જ્યારે તમને કોઈ questions હોય, you really must get a more personalized consultation with me to get proper advice. But let me give you some demonstration of what we can do and a slightly different view on this. That's the whole idea of today. એટલે હું જ્યારે કહું કે દવા નહીં લેવાની, I'm not saying તમે સવાર ત્યારે દવા બંધ કરી નાખવાનું. તમારે ધ્યાન કરીને સાંભળવાનું, તમારા actual doctor કે કોઈ પણ તમને આપ્યું હોય એ પહેલા સાંભળવાનું, પછી વિચાર કરવાનો કેવી રીતના કરવાનો આગળ જઈને. So today what we'll talk about is a handful of things. We'll talk about pain relief, we'll talk about real back and neck pain, and then we'll talk about trapped nerves, sciatica, hip pain, knee pain, shoulder and arm pain. So I hope this is going to be really great and useful to you. Like I said already, please make sure you ask me questions, and I can see Com's already typing away, so I'm sure some questions are already coming through, so I'm looking forward to answering them as we go through. So please do keep the questions coming as well. The પહેલો topic છે, there is no cure for neck or back pain. What do I mean by this? The reason I say this is because આપણે જ્યારે adverts જોઈએ, Nurofen adverts જોઈએ કે કઈ દી દવા જોઈએ, એમાં કે the latest cure for back pain, the latest cure for neck pain. Now અમારા એક key fundamental problem છે, because neck pain કે back pain આ condition નથી, આ diagnosis નથી. આપણી પાસે diagnosis ના હોય તો એનો cure કેવી રીતના આપણે ગોતી શકીએ? That's why these are symptoms. હું તમને કહું કે મારા neck દુખે છે, but there could be hundreds of different reasons why my neck is hurting. એટલે આપણે ખોટી treatment આપીએ કે ખોટી દવા આપીએ for that particular condition, then it won't work. તો જ્યારે પણ હવે તમે જ્યારે જો કાંઈ પણ advert જો કે આ neck pain નું cure છે, તમે એક મિનિટ વિચાર કરો કે actually is this neck pain, કે what specific cause of the neck pain is this the cure for? And that's what we have to look at. So what happens with osteopaths and chiropractors, we are very, very skilled at finding the root cause of the problem. And we do that because તમે જ્યારે હમણાં પાસે પહેલા આવો for your first appointment, just like તમે કોઈ દિવસ ડૉક્ટર પાસે જાઓ કે ડેન્ટિસ્ટ પાસે જાઓ, before they do any treatment, પહેલા લોકો તમને બહુ questions પૂછશે કે what is the problem, ક્યારે ચાલુ થયું, what makes it worse, what makes it better, all those different things. એના પછી અમે examination કરશું, તમારું posture check કરશું, કેવી તમારા movements છે, અમુક nerve test કરશું તમારા, અમુક heartના conditions check કરશું. We do a range of different things, very similar to how your GP would test you. એના પછી we really find the root cause of ક્યાંથી source of the problem is coming from. And today I'm going to demonstrate some stories of some of the patients that I've treated over the years, and you'll really see how that pain over here was actually because of something over there. So it will make much more sense. But first of all, I really want you to take on board, there is no cure for a symptom. There are only cures for conditions. So we must think about this when we go forwards. So when I treat my patients, I'm not ever prescribing any drugs, and I'm never prescribing any surgery. Now, for those of you who know me very well, we spoke with some of the hosts earlier on, you know that I come from a background where my dad is a pharmacist. So I come from very much a background where I've grown up in the pharmaceutical industry, if you like. And on that point, I'm not saying we don't take drugs at all. What I am saying is we have to be careful about what we need to use the drugs for. However, let's just use a little bit of common sense. જ્યારે આપણે કોઈ દિવસ GP પાસે જઈએ ને એ લોકો બ્લડ ટેસ્ટ કરે ને સપોઝ લગાવો કે ઓકે તો તમારો આયર્ન લો છે તો ઓબ્વિયસલી આપણે આયર્નનું સપ્લિમેન્ટ લેવાનું. That makes sense. પણ કોઈ દિવસ કોઈ પાસે પેરાસિટામોલની deficiency ના હોઈ શકે. There's no such thing as a paracetamol deficiency. It doesn't exist. Paracetamol is not a natural chemical inside our body. You shouldn't need it. If you need paracetamol, then you must be at a very desperate stage of your pain or your condition, or even things like any strong painkillers. So we've got to think about how can we, if paracetamol or any drugs like that, any painkillers, they don't exist in our body naturally, then how can we make sure that we can fix the problem, reduce the pain, therefore you can then heal correctly. So this is what we have to do. Now also the other side of it is surgery. Surgery fine, it'll be fixed. But I always tell my patients that if surgery karvu hoy, make sure you are as confident with having the surgery as you are having a tattoo across your forehead. If you're not confident with having a tattoo over your forehead, for whatever it might be, then you shouldn't be confident having that surgery, because surgery might have the risks hoy sake as well. જ્યારે પણ આપણા ડૉક્ટર પણ કોઈ કહી શકે કે તમે આ કરવાનું ઓલું કરવાનું, પહેલાં લોકોને પૂછવાનું કે ઓકે આના બેનિફિટ્સ શું છે અને આના રિસ્ક્સ શું છે. તમારે આરામથી થિંક કરવાનું કે આર ધ બેનિફિટ્સ બેટર દેન ધ રિસ્ક્સ ઇન યોર કેસ. યુ મસ્ટ ટેક ટાઈમ ટુ ડિસાઇડ ધીસ થિંગ્સ. But this is also true for the treatment that we provide. And our treatment શું છે is we put our hands on our patients, we mobilize the joints, we mobilize the muscles, we get things working. And જ્યારે mechanical કાંઈ problem હોય, then એના માટે કોઈ chemical solution ના હોઈ શકે, because it's a biomechanical, like a physical problem. So you need to get hands on, you need to move things around to get them functioning normally and functioning better. There's no pill or tablet or surgery that will do that same way. We have to utilize the body the way it's designed to work. So all these things that she started in America back in 1800s, so history lesson આપું તમને. આપણે શું થયું હતું કે osteopathy and chiropractic, they're separate professions, and this is why UK there are thousands of osteopaths, there are thousands of chiropractors, but only 3 of us are both in the UK. So it's very rare to have this combination of 2. And I'll give you an example of what happened in America. See, osteopathy, the founder of osteopathy was actually a medical doctor. Would you believe it? A medical doctor was the founding father of osteopathy way back in 1874. And there must be a better way of treating patients rather than using drugs or surgery. And let's be fair, pharmaceuticals and medication wasn't as powerful and effective as it is today, and it wasn't as safe. A lot of the medication was either alcohol based or daru hoyema, or there was mercury in there. But nowadays we know we've come a long way. But that was where it started off. The whole point there must be something within the body, body our own dawani chest, medicine chest hoy, that we can then open up and then heal within. And also 20 odd years ago, there was D.D. Palmer. D.D. Palmer was the founder of chiropractic. And then he founded how the nerves, he realized that the nervous system controls everything in the body. So when I've treated my patients, I've combined both these modalities, and I've found I've had outstanding results with my patients with this. So it's really amazing to be able to share this with you today. So the question is, if this is so amazing, so powerful, it's been around for so many years, Why doesn't your GP know about this? Well, the truth is they do. And the truth is that particularly in the UK, we've got the NHS, which is wonderful. And the thing is that our GPs are not fully trained or fully aware during their qualifications, during their studies of exactly how chiropractic or osteopathy can help. And the thing is that they learn more about the pharmaceutical industry or surgery. And the thing is, a funny thing I find કે આપણા GPs જે છે એ લોકો પોતે મારી પાસે આવે છે patients તરીકે. This is Dr. James, he's a GP. He comes to see me for treatment. I've got here a nurse, Sarah, she's also a patient of ours. And we've got all of their families as well. It's never this thing કે અમુક વાર તમને દાસે કે GPs ને chiropractors or osteopaths સાથે ઝઘડો છે. There isn't this ઝઘડો. All it is કે GPs ના protocol હોય અમુક NHS માં કે they have to follow that. But if we go to different countries, let's say we go back to America, ત્યાં આગળ શું છે, they have different options. They have તમને insurance હોય America માં mainly, for example, then you can have the option. Can I go to chiropractor? Shall I go to the family physician? Shall I go to this particular specialist? Whereas આપણું શું છે, આપણું mindset UK માં કે આપણે GP પાસે પહેલા જઈએ. But we must also think, is the GP going to be able to find the root cause of the problem? So really think about who is the expert. Now, I'm not going to tell you that we're going to cure everything because this is not true. But what I'm going to tell you is that for certain conditions, GPs are great. But for areas like this, we find that a lot of patients, they will have gone to their GP, they've gone to the physio, they've gone to all these other different ways. And after weeks or months, they've gotten so frustrated, their problems have gotten so much worse that they wish they'd started up with us sooner. And once they get the benefit of what we do, they really are grateful for that. So why don't we just bypass that and take the strain off GPs? During the coronavirus તરીકે, we've had lockdowns, right? But our professions have told us we must stay open. So I've been an essential key worker for that because it takes a strain off the NHS. So let's do that for our GPs and our nurses and help them so that we can make sure that we get the care that we need so they can take care of other things that they're good at too. So what is a trapped nerve? Trapped nerve, what is this thing? Well, a trapped nerve or a pinched nerve, it comes from different sources. So let me give you an example. By the way, don't worry, for those of you who are wondering, this is not my first patient. This is just a plastic model. But this is what our spine looks like. This is the back of your spine and this is the front of your spine. And in our spine, we have 24 bones, individual bones like these. And in between these bones, we have discs. These are like spongy shock absorbers. Everything આપણી ગાડીમાં suspension હોય, that's how these discs act. And in between each bone, we have these yellow nerves. તો આપણા જે ગળમાં જે main frame હોય, આપણું brain is up here, then it sends all the wiring down inside the spinal cord, and then it exits each part. આ જે બધો જે nerves નીકળ્યા, they supply everything in the body. તો આપણા જે neckમાંથી nerves નીકળે, these go up to the head, but પછી આપણા armsમાં પણ જાય. In the middle part of the back here, these go to all of our organs. Ne આપણા જે lower back માં છે બધા nerves, they go into our pelvis organs and down to your legs as well. So what happens is કે આપણે જ્યારે થાય કે મારા leg માં દુખે છે કંઈક, કદાચ pinched nerve હોય કે trapped nerve હોય. અમુક વાર we might have heard of a friend or family કે મને પણ એવી રીતના થયું pain leg માં. ને મારા ડોક્ટરે કીધું કે મારા પાસે trapped nerve છે. Okay, fine, trapped nerve હશે, but where is the trapped nerve? And then where is the nerve trapped? We must find this, right? Otherwise, it doesn't find the source of it. For example, આપણે અત્યારે ઘરમાં જોઈએ કે આપણે light on off થઈ ગઈ છે. However, we all know કે આપણે lightમાંથી wiring છે switchમાં wall ઉપર. We can turn the switch on and off. But if that doesn't work, we can also go to the fuse board and switch the fuse as well if the fuse has been flicked. And if that doesn't work, we might check on the street. Lighting, it might be something wrong with the mains. So what we do is we need to find the source of the problem. The source could be something in the brain. The source could be somewhere in one of these individual parts of the nerves. It could be somewhere local. So nima duktu hoy, because nerve pinched hoy nima. That could be also possible. So when you first come to see us, we find out exactly where the source of that problem is coming from. Pachi e area માં આપણે જે પણ condition pinch કરતો હોય એ કાઢી નાખી શકીએ. હવે for example, you could have joint inflammation, that could also pinch on a nerve. You could have muscle tightness, that can pinch on a nerve. you might have some sort of internal hemorrhaging or bleeding that can pinch on a nerve. So there's lots of different reasons of what can cause a pinching. It's not just about is it joint inflammation that's causing the pinching. What we have to then do is think, okay, joint inflammation hoy, the inflammation and why was it there in the first place? And that's what I do, is I look at the lifestyle of that patient. Recently, somebody told me that all they were doing was they were waking up around 5 o'clock in the morning getting some pain in their finger. Did you kali 5 વાગે every morning, dukhe angrima. પછી મેં લખાવને પેશન્ટને જોયા ને મેં ચેક કર્યું કે શું થાય છે, and basically found કે એ જે નર્વ હતો ફિંગરમાં, it came all the way up to the neck ને નેકમાંથી કંઈ પ્રોબ્લેમ થતો હતો. એટલે મેં આ નેકમાંથી રિલીઝ કર્યું, and suddenly they didn't have the pain in the mornings anymore. So when you find the source of the pinch nerve, that will release it all completely. Rather than just thinking, apne થાય કે આંગળીમાં કંઈ થયું છે, કંઈ દવા રબ કરું કે કંઈ કરું આંગર. But that didn't do anything because the source of it was up here. આ કંઈ નહોતું. And this is the example that I was giving. Upper neck, upper spine chair, there's 3 main sections. Upper neck is what the professionals call cervical spine. And there are 7 bones chair. See 1, 2, 3, 4, 5, 6, 7. E nerves, they go up to your head, shoulders, and down to your arms and hands. But you have a thoracic spine chair. Thoracic spine is where you've got your rib cage. And if you could put your hands on your ribs, this is where you can feel your thoracic cage actually. And that's 12 bones. And then you have your lumbar spine, that's only 5 bones. And those nerves go down to your legs, to your feet. Now within the spine, okay, discs, they can have different types of disc problems as well. If you've got a disc that's causing the nerve to be pinched, there could be a number of different things. So let's look at some examples. We've got a normal disc at the top there. Then you can have a degenerative disc. આપણે degenerative disc ની વિચાર કરીએ તો આપણે થાય ઓકે કોઈ મોટી ઉંમરના કોઈને કાંઈ થશે આવી રીતના. Except degeneration actually starts as young as in your 20s. So all of us, when we were in our 20s years old, that's when we stopped growing and that's when we start degenerating. Then we've got bulging discs. હવે bulging disc માં તમે ધ્યાન રીતે જોજો પાછળ, you can see there's a bulge there in that image. So that will bulge on where the space where the nerves come out. However, bulge then it can go into the next stage where it can become herniated. Herniated is almost like a slipped disc. Some people get told that they have a slipped disc. That's what a herniated disc is like. A thinning disc can be very similar to degenerative disc, and when you get a very severe degeneration, then it can be osteophyte formation. Bones start growing. You get arthritis type changes in those bones as well. So all those are different types of possibilities where they can possibly pinch on the nerves. But here's the thing, they've done many studies on patients with 0 symptoms, no symptoms. The people didn't know what was, that they even had any problems. And what they did scans on these patients. They did an MRI scans. And they've done this so many times, they found there's a significant number of people with no pain who have herniated discs, they have bulging discs, they have degenerative discs. So the thing is, there's now a thinking that actually sometimes these discs may not be as involved as we thought they were, because the disc might not be just the root cause of it, there might be something else going on as well. So it's getting very interesting about looking at if somebody's got no pain, they might still have a problem that they don't know about. So this is one of the things that's really important. You know, આપણે regularly blood pressure check kare. We'd regularly go to the dentist to make sure we get our teeth checked. But who's regularly checking your spine? So we've got to really find somebody who you can go to on a regular basis and make sure that they're checking your spine, checking your body, checking your health, to ensure that you catch things before they get worse, and you can also help them get through any problems that they might occur as well. That's what we do, chiropractors and osteopaths. Sciatica is a very common term that's also thrown around. So you might have been told, or you might know somebody who said, oh, mane etlu badhu pain thaytu back ma ke leg ma, and I had sciatica. My problem with sciatica as a diagnosis is it's not a false diagnosis. Sciatica no definition suche ke it's pain in the distribution of the sciatic nerve. So the sciatic nerve is one of the largest nerves that goes from your lower back into your legs. It goes down the back of your legs. The sciatic nerve thumb is as thick as your thumb. It's the thickest nerve in your body. It's really thick. Have a good look at your thumb right now. That's a thick nerve. It looks thick hoy apru. Now, if we've told that we've got sciatica, we have to find out where is the sciatica coming from? What's causing it?
I do have a question regarding sciatica.
Oh, excellent.
So Deepa has said that she suffers from sciatic pain, which goes all the way down the left leg and gives a tingling feeling in the left foot. So any advice would be appreciated.
So Deepa, you're going to love this. So you're absolutely right. Your symptoms are very, very typical of sciatica. So what's Deepa's feeling in a tingling taiche foot ma. Pins and needles tingling jautai sensation is changed. And it's a little bit like जो light to dimmer switch होए अपने nerve ने pinch करे और reduction करिए नु, then obviously you're going to get reduction of the flow of the nerves. Now the sciatica can come from a number of places. So in Deepa's condition, if she was to come to see me as a patient, my main role would be to find where is it being pinched. Is it something that's happening within the buttock area? Apra muscles if they are tight, it might be pinching on that nerve. So apra muscle release karano. However, if it's not from there, then that's a big waste of time because you haven't done anything. Because it could be a pinching in the lower back from the number of different things we talked about. I think it could be a disc, it could be a joint inflammation, it could be some other kind of lesion that's occupying that space, that's pinching on there. So we've got to really find what the source of it is. So Deepa, in your case, I would definitely make sure that rather than, I don't know how you've come across your possible diagnosis or considering that you've got sciatica pain, but certainly, first of all, don't Google things because Google will always show you the worst case scenario. Always go to a professional so you can find out what the source of it is. Don't take sciatica as the diagnosis. You have sciatica because of a what? Is it the muscle that's tight in the buttock area? Is it the pinched nerve in your lower back? Is it something else? Let's find out the source of it. So make sure you have a full diagnosis. So I wanted to share that with you in the short amount of time I have, that sciatica is one of the common trapped or pinched nerves that we see, that we hear about, but there's many, many others. Okay, so have a little think about what other ones you could have and feel free to ask me any questions about that too. But if any one of you has ever been to an osteopath or a chiropractor, you might have heard we move the joints in such a way that a popping sound ave from the joints. Now when we crack our knuckles, you can do the same thing in the spine. But there's a very big difference between just making the spine pop and actually having it adjusted by a professional. See, I know exactly how to do this on my patients, but I never can adjust my body correctly the way I want to do it. The reason is because when we're not looking after our body well, I guarantee majority of you on this call, I've not regularly seen a chiropractor or an osteopath the way that we would regularly see our dentist. So therefore we do not know if all of your spine is working optimally. So if that happens, then some of the joints will become a little bit more stiff. So let's say, for example, our mid-back upper stiffness tie, but we wouldn't really know about it. We just kind of carry on with life. We don't realize that. And time goes on, and then suddenly we realize that the lower back is starting to work a little bit harder than it should do. Strain thigh. And all it might take is you just literally bent down to pick something up, haven't tried anything hard, and suddenly boom, your pains come on and it's become really agonizing pain in the lower back. So if that happens, if I even have that, for example, then what would happen is if I try to treat myself, try to make my back work better, I'm only going to aggravate the pain in the lower back because I'm only going to be able to move that more on my own. So I have to go see my colleagues if I want to release the joints that need it rather than the ones that are already overworking. So never try and treat yourself, even especially if you're not a professional, but even then, as a professional, I don't treat myself. I get my colleagues to treat me too, because they can find and really be focused on the areas that need the treatment rather than me trying to just make things happen by themselves and aggravating the problem. And this is what a closer look at what our spine looks like. So on the left hand side, you can see that's the front of your spine, and on the right hand side, you can see that's the back. So those knobbly bits you can feel on your spine, those are those bumps. And the facet joint, the facet capsule, that's the joint there. So you can see there's a very small space between the facet joint and where the disc is. And that little space right in the center in front of that round black circle on the left of it, that's the tiny space that the nerves, these yellow nerves, come out from. There's not a huge amount of space. So we must make sure that we're looking after this, because this is a very common thing that can happen. The nerves can be pinched. It's called nerve root impingement, NRI. Different thing than a non-resident Indian, right? Now let me tell you about Lisa. Lisa came to us with hip and knee pain. And she'd been suffering with knee pain. She could hardly go up the stairs. She was really creaking. You know, when we get up from the chair, and that's what she was doing. She felt it all in her knee. In fact, in her left knee, really. Her left knee was really painful.
And it was creaking.
It was creaking. Like Dravajanatai when it needs to be oiled. And obviously, I'm not going to put WD-40 in there, right? That's not the answer to this. So what happened? Well, Lisa came to me first and I said, well, what's happening? My knee's hurting. And English ma bolti thi because she's not Gujarati, right? But I'll give you some of the Gujarati anyway. And what happened was I did a thorough investigation. Guess what? I found actually the knee was pretty good. It wasn't that problematic. When we went to it, we found there was a big problem in her lower back and her nerves were being pinched in her lower back. So I started treating her. So she started getting better. Knee pain very quickly. But she came in one day and said, Trishul, I don't know what you've done to me, but I came to you with left knee pain and now I've started getting right foot pain. What are you doing to me? She was getting confused. What's happened? Then I said, Lisa, what we're doing is we're undoing all the things that have been happening in your life until now. So all those different things that built up, we're undoing that. We're kind of going back in time. So think to a time that you might have hurt your right foot. Okay, no, I've never ever hurt my right foot. Never. I said, okay, well maybe not, but just think for me and see if you come up with anything. So the next time she came in, she said, Trishul, you're right. I said, all right, I need to be more specific. What do you mean? She said, I did hurt my right foot. I forgot about it. And what happened was her son had accidentally stepped on her right foot as she went to turn many years ago, and that caused her right ankle to cause a lot of pain. She just totally forgot about this. And it's a very common thing that we see कि हमको right foot में problem था, तो left knee में problem था, પછી right hip में problem था, zigzag pattern था वहाँ. And when you really unravel all that, you find the source of it can come from somewhere else. Just like the light switch in her case was here, and that resolved everything. But the thing is that the knee pain she'd had for so long, she didn't come to see me for the knee pain. What she actually came to see me for is because the knee pain was concerning her about going skiing. She loves going skiing every year. Your ski boots, if you ever worn them, your ankle doesn't move. A lot of movement goes to the knees. So she was very worried about this. I said, well, Lisa, let's put a plan together to make sure you can go and enjoy your skiing. And one of the things I haven't told you about the story, by the way, not only did she go and go for skiing and she had a great time and she's been doing wonderful since then, but another thing that happened with Lisa, she's got a very stressful job. And one of the first things she told me was she takes antacids for her stomach because she's got acidity. And whilst I was treating her, and after a few sessions, I monitored her progress. I said, Lisa, how's your heartburn been? She said, Trishul, you know what's really strange? You should ask me that. Ever since I've been coming here, and by the way, I've had heartburn for years, ever since I've been coming to see you, it's gone. I said, oh, that's interesting. Fine. Then I carried on. After a few more treatments, Lisa, how's the heartburn? Trishul, it's not come back yet. Good. Carried on. Guess what? It's not come back yet. Now, am I telling you that I can cure your heartburn? No. Can I tell you that I can make your body work better? Yes. That's what I did. I did not cure her. Not for her knee pain, not for her hip pain, not for foot pain, not for her low back, not for her skiing challenges, not for her heartburn. What I did was I found what her body wasn't doing correctly and I got that functioning better. Once we got that functioning better, it does what it wants to do. આપણી બોડીમાં છે ને conflict થાય ને ત્યારે problem થાય. And જ્યારે problem થાય ને, then we go and seek help. But what we need to do is go back to the point where before the conflict occurs in our body, make sure the conflict doesn't occur. If it does occur, we resolve it very quickly, and then we can function optimally. And that's the difference, you see. We should be really thinking, rather than just living in a lifestyle of survival, we should be thinking, how do we live in a state of thrival? We should be thriving right now. We should be in optimum health. So that's Lisa for you. And this is just a quick example of looking at the nerves. So I told you already, right? The nerves from the neck, they go into the head and the arms, but look at all the different organs they go into. The ones in the mid back, they go into all the different organs there, and all the ones in the lower back, they go into all those organs down there as well. So our entire body is connected with nerves. Our nervous system connects everything. It's the powerhouse. Just like in your home, if you turn off electricity, that's exactly what happens in our body as well. So we're experts in finding which problem is going from where and how it affects everything else. I mean, for example, let's just take one on here. Have you ever thought logically, ke koi ne left arm pain thai, apre we think, ane kain heart problem thai che. But logically, let's think about it. Left arm is all the way here, and my heart is all the way here, deep inside my chest, protected with my ribs. What is the link between the two? That doesn't make any logical sense, does it really? Apru, arm is here, and the heart is here. And the reason why, if you've got a heart problem, that you think you have pain in the arm, is because ije nerves je arm mati ave, and they go back into the spine, goes into the same section of the spine that the heart nerves go to. And our daily living masutaike, we learn from experience. So in life, we knock our arm more frequently and regularly, so our brain learns ke e signal je ave section ma, that's the arm hurting. But when on the odd occasion, if the heart has a trouble and it goes to the same section, the brain will look back at history, think, okay, past ma kya hato? It was in the arm. Let me tell them that the pain was in the arm. And that's so true for so many different things. For example, upper right shoulder pain thai, one of the questions I ask my patients, is it your pain worse in the shoulder, in your right shoulder, after eating a heavy meal? Because upper jare heavy meal khaye, there can be more fats. The upper body fats to digest kara mate, we need to produce more bile. Now upper gallbladder has to work harder with our liver, and so that refers to the right shoulder. So this is the depth of knowledge that osteopaths and chiropractors have. We study for 4 to 5 years on each of those degrees to get to the depth of knowledge of not just in terms of the anatomy and the physiology, but down to the levels of exactly what the nervous system is doing as well. So let me tell you about Wendy. Wendy's one of our patients who just started coming to us really recently. And if you want, you can see her story. I've posted it on my Facebook and Instagram fairly recently. Wendy, what happened with her was she was working in a supermarket and she had a stack of these, those what do you call them? Those crates, had some heavy crates, and she had to get to the middle one, but had all these heavy ones which are above her eye level. And because they were above her high eye level, she couldn't see what was in there. Then and it was quite difficult for her, but she managed to do it, and then she carried on. She didn't think anything of it. Iratna, she woke up with pain in her left forearm, tingling jautyutu. But she didn't think much of it. But 2-3 days, the tingling didn't go away. It was still there. Amma. To GP passe gaye. But obviously because of COVID, GP did a telephone conversation and consultation. GP ke jo painkillers le to require, see how you feel. Then 5 divas mate lido, full dose ma, didn't do anything, didn't touch it. Aji tingling tatu. In fact, the pain was starting to now come up to the shoulder area. The spread tawa mendo. But long story short, and you can see her story, she went to an osteopath. The osteopath said, I think it's this, that, the other, better session lida anisate, kai fair na pero, really long term mate. Then she went and did all these other things she tried to do, and she was really getting desperate. Now it had been 8 or 9, almost 10 weeks had passed by now. And she said, what do I do? The medication the GP's given hasn't helped. I've been to an osteopath, that hasn't helped, and the osteopath doesn't know what to do anymore. I don't know what else to do. So she was going on YouTube and going on Facebook, searching for how to help neck and arm pain. and she came across one of my videos explaining about how trapped nerves can affect things. So guess what? When she came to see me, not only did we resolve that neck pain and the arm pain, but all the function returned as well. And she'll tell you very quickly that happened. And she was like, I wish I just came to you first thing, because I've just wasted 10 or 11 weeks of my life being so miserable. And she's a lovely person. She loves being active. She loves doing all these things. And her husband's a paramedic. And her husband was saying, yeah, all these things aren't going to work. You know, we need to go and see Trishul. I've seen his video. Yeah, we should go there as well. Absolutely. So thank God she did that. So these are kind of stories that I like to share with you, because I hear it so often every week. Trishul, I wish I'd come to see you sooner, you know. So please spread this information. Now that you know about these sort of things, please tell people that, hey, we should get these things resolved sooner than later. It's not worth experiencing unnecessarily. So shall I give you a little, I'll give you a little preview. I'll give you a little gift. For those of you who want to take part, feel free. If you don't take part, that's fine. But here's what I want you to try. If you can, if you feel happy to, I want you just for a moment, just stand up for me. Just stand up normally, as best you can. I'll just wait for Komal to give me a little bit of a nod to see how you guys are getting on, because I can't quite see you all. How's this? Have we got some people standing up?
A couple of people.
Excellent. Well done. Those of you standing up, well done. Okay, fantastic. Now what I'm going to ask you to do is sit back down for me just for a moment. Now I can't see you, but I've done this so many times, I'm pretty sure there were a number of you that when you got up, like, oh, right? Okay, sometimes it can happen like that. However, without even treating you, without touching you, through the power of this screen, I'm going to give you 3 tips on how you can stand better when from a sitting position. Okay, ready? Step 1. I want you to come to the very edge of your seat. As far forward as you can, but alright? So make sure you're sitting there still. Okay. Step 2, I want you to, as you're sitting there at the edge of your seat, I want you to straighten your spine. Long body, really straighten that. And step 3, protection and suck it in really tight. From this position, when you're ready, stand up for me. How are we doing, Komal? How is everyone's getting involved?
Some people are, but I think
fantastic. Most people are enjoying relaxing and watching the show. Fantastic.
Oh.
But those of you who stood up, I'm pretty sure you found that second way much more easy than the first method. And the reason you did is because very temporarily we made sure that your body was aligned in a better position, in a better posture. We got your muscles engaged with your movement, and we got you functioning the way your body is designed to work. But the difference between how you did it now and how you would do it if you were one of my patients is you wouldn't have to think about it. For example, we didn't have to think now, but we chana karo pe okay, who gave it a move karo, okay, so karo. Have kai niche pare floor, think over again, how shall I get that thing off the floor, right? Whereas we don't think that our whole body should be working, our entire body should be working as if we're 6 years old, no matter how old you are.
Can we make a suggestion and just switch the screen share off, because they want to see your beautiful face?
Oh, is that right? Okay, let me see if I can do that. Can you all see me now? Everyone happy? Okay, brilliant. I can't see my slides now, so I'm going to be stuck. Let me see if I can.
I have faith in you.
You have faith in me. Okay. Can you all still see me now?
Yeah.
Okay. We have trouble getting in the right position. How do we sleep? Do we sleep in our side? Do we sleep on our front? Do we sleep on our back? What's the best position to sleep in? So just help me so I can get some feedback. Tell Komal in the chat box, do you like front, back or side? Just write one word, front, back or side. What's your favorite position? તમે સુવા જાઓ કયો position તમે સુવા ગમે? Front માં, back માં કે side માં?
Side, side, side.
Side, side, side. Yep, everyone likes sleeping on this side. Aritna, right? Okay. Well, the thing is, let me just for a moment, I know you want to see me, but I just want to share my screen just for a moment because I want to show you something really important on this screen is that, yeah, that one. see, if we're sleeping on the bottom screen there, if we have too few pillows, we can really put a strain on our neck or on our shoulder because we're putting a lot of pressure on that side. So if we sleep on our front, okay, first of all, which no one's doing, but if you sleep on your front, obviously if you twist your head to the side so you can breathe, so that's no good either. So side and front is no good. On your back is better if, like in the top picture there, you don't have too many pillows, okay? So what I want you to think about is when you now sleep tonight, look at your pillows and think all you need to do कि आपको जब upper back of the head में support ना जोए, upper back of the neck is support जोए आपने. Like sometimes you can get away with just a thin pillow and you don't need anything fancy. Just a nice thin pillow just to support the back of your neck and lying in that position. હવે મને ખબર છે કે અમુક તમને કહેશો કે oh but I always like on my side, I can't fall asleep on my back. What I would advise you to do is for tonight, try just lying on your back for 5 minutes first of all, and then sleep in any position you feel comfortable. But tomorrow, try for 6 minutes and then do what you like. And the next day, try for 7 minutes and then do what you like. And every day, once you add a minute, your body will start to get used to lying on your back, and you'll find that you will feel much less stress in your body, much less tension. You'll find that your neck and head and everything will feel much easier. So give that a go. Also, some of you might say, yeah, but my wife or my husband kicks me because I snore when I sleep on my back. All you then do is do what I do for my wife, is buy her a year's supply of earplugs, and that will solve everything, right? Come on.
Absolutely.
And that's how you then do it. You sleep like a professional. So, 36 hours. What am I talking about? No, I'm not talking about the number of hours in the day because that's 24. I'm talking about how long it should take for a pregnant woman to have labor. 36 hours. Is that right? Is that how long labor should last? No. Labor should last only an hour and a half, give or take. And so what I'm telling you કે આમાં શું છે કે આપણા જ્યારે કોઈ woman pregnant થાય તો આપણા body 9 months it goes through a lot of changes. There's a lot of strain on the joints through here because there's a lot of weight that we put on there, right? We're really grabbing a lot of weight through there, a lot of tension through there. Also hormones change as well. And also men in the room here, I'm grateful now for being a man because this is what nature has designed for a human baby to fit through. This is life size and the baby doesn't fit through there. So it's quite difficult. So you have to ensure that during the birthing process that everything is optimized. Now, one of the things I know for sure over the years that we've been treating pregnant patients, those who have treatment before, during their pregnancy have a labor time of just an hour and a half, compared to those who don't, on average, have a labor time of 36 hours, give or take. So I know as a man, I'd prefer an hour and a half. So please spread that around to anyone you know. Maybe it might be your daughter, your granddaughter, or some friend or relative who is pregnant. Make sure they're getting care they need. And the other benefit is of having a shorter labor time is less stress on the baby as well. So you get this wonderful thing of everyone's getting a nice, easy process, which is what we want. And so that also leads me on to the fact that we don't just treat people who are older. I mean, and we look after them too. Remember, right now, children are on their devices, right? They're either playing games or they're on iPads or phones, and they might be studying on their laptops, or they've got still heavy bags. The number of children we've seen, especially coronavirus there, like on a lockers nana chair, and they have to take everything home with them. They've got bags that are even heavier than before. And so there's a lot of strain on the body when it's still developing, still trying to get how it should be. So you've got to really look after children in that way too. Yeah.
So I have a question which is not so much to do with children, but it is to do with working from home.
Sure.
Which is really useful. So Bharat has asked, since I started working from home due to COVID, he started getting lower back pain on the right side. Potentially due to the chair that he's using at home, and also because he's working from home, he's sitting a lot more, so it's like his butt, like the cushion, it's gone, and he feels pain on both sides of his buttocks.
Okay, Bharat, that's a great question. I want to tell you something that I tell all my patients, okay? The question is, and this is how I get this is my secret sauce, this is how I get amazing results. The question is, if everybody did what you did, so if everybody was working from home, everybody was sitting on the type of chair that you're sitting on, for the amount of hours you're sitting on, for the way you're working, would everybody have the same type of pain? No, they wouldn't, would they? So the thing is that there's something different about you and your body that's led you, in addition to those other factors, that's pushed you over the edge. So what I'm saying is, first of all, absolutely, we need to think about how you're sitting at home and how you're working, but also we need to look at what's underlying that, what's been there for so long before that, that's not helped. Let's remember also, adding on to that, we haven't had a great time, have we, during COVID? It's been locked down, it's not been fun, we haven't been able to see each other so much. So there's some psychological, mental, emotional stresses to this as well. On top of that, we're not really working properly, and what I mean by that is I've got a lot of my patients who used to commute an hour and a half each way to their office, and they used to regret that before COVID, but now during COVID, they're like on and they miss it. Because it used to give them a mental break. Okay, work is finished and now I can go and spend time at home. But હવે શું થાય કે આપણે કામ પતાવીએ 5 વાગે 6 વાગે પછી after dinner we think, oh, let me just jump on the laptop and let me do a little bit more work, and we carry on. So we don't have this clear cutoff anymore. So those sort of things is something I've seen commonly with regards to not just being back pain from the mechanical stresses that you described, but it can also be the emotional stresses related to the work environment that you've now created at home, which is not any fault of your own, it's just the environment that we're living in right now. So we need to find a way to break that cycle so that you can go back to how you really want to be.
Shall I ask a few more questions?
Yeah, let's do that. Whilst we're on that, we can do some questions right now.
So I've got Neelam. So this is a question which has come up a couple of times. So I get lower back pain. She's had it for nearly 3 to 4 years. They, I'm assuming the GP, are telling me to have an injection for her lower back. So please could you advise? And some Jitu Mehta as well has asked, what is your opinion or view on using steroid injections, which are suggested by the GP?
Cool. Okay, great questions. They're very similar. So I'll answer them both together. Remember my first point was things such as paracetamol are not naturally found in your body, so why would we put them in the body? And so if we're looking at true health, we're not talking about just pain relief, we're talking about your body functioning the way it's designed to function. Then for me, without knowing anything about you, remember I'm not here to give you medical advice right now because I don't know enough about you. I am giving you a different viewpoint of generally how we can think about things. I would just pause and reconsider what are the benefits versus what are the risks of putting this inside my body, and also what's the long-term effect. Once you do it now, what happens once it wears off? Do you need to do it again? But then that's not resolved the underlying problem. All that's done is just let it carry on. So it really depends on what you want. A lot of the patients that see us, they are tired and fed up of having to go round and round in circles because they're not really getting the underlying problem resolved. My advice would be to really find out if there is someone, if you haven't already tried an osteopath or chiropractor or a physio who works in the same way as we do. And the best way to find them, first of all, is just like a medical doctor or a dentist, they have to be on a register by law in this country, in the UK, to use that title. The title osteopath is legally protected. The title chiropractor is legally protected, meaning that you know you're in safe hands because you can look up, is this person on the professional register? That already gives you a big tick. Okay, this person is good, they're qualified, they've done the right things. Then the second way, like you would do with anyone, is maybe go by personal recommendation. Has somebody tried that particular practitioner? I just gave you the example of Wendy. Wendy went to an osteopath and she had 3 or 4 sessions and didn't get much benefit. Now, I have no doubt that osteopath's a very good osteopath. I don't know who they are, but I know they are because they are an osteopath. They're on the register. Just the way they did things was different. Just like when you go to 2 different doctors, they've got 2 different viewpoints. So my point would be, first of all, think, is the advice you're getting just a protocol that's being followed that has to be done for those on the NHS, or is it something that's in line with the latest research, the latest best techniques, the best way to get your problem resolved? A lot of the time you'll find things like back pain, we've got to find out, remember, all I know is that you've got a symptom. All that you know right now, you've got a symptom in your lower back. But what is the diagnosis? What's the cause of it? If we don't know the cause of it, it doesn't matter what you do, you need to find the source of it. So that's what I would suggest first. We need to get a really good diagnosis. And the way to do that is find someone who's an expert in finding the source of the problem.
This is are you okay to
I'm cool, yeah, I'm excited.
So this is a really interesting question, and we hear it a lot at the clinic as well. So this is from Avinash. He has lower back pain problems, which he's had for the last 29 years.
Whoa!
And he's been seeing a chiropractor for 29 years. At least once a year he gets the back pain and he has to visit the chiropractor for 8 to 10 sessions. So does the back pain ever go away?
Well, okay, first of all, straight away I'm going, what's the cause of the back pain? What is the diagnosis? Okay, that's what we have to go to first. What is the diagnosis? So Avnish, if you're happy to share, feel free to share. What is the diagnosis? Secondly, my second question is, if it happens every year, think about the modality that chiropractor is using. Now, one thing I haven't told you yet, which I'm going to share with you now, is the two broad ways that osteopaths and chiropractors work. There are some osteopaths and chiropractors or health professionals who live and work in a philosophy of being symptom-based, pain-based, meaning that they will help you get rid of the symptoms. Pain, then fine, stop care. But then you've got another type of thought, which is, once you are better, we then keep you better by making sure we keep tweaking things. Just like I don't get tooth pain, but I still make sure that I get my teeth checked regularly to ensure I don't get problems with my teeth. Like when we get our car MOT'd or serviced, there's no problem with it, we're just getting it checked and done. So that's the same thing that I believe in working. Now the reason I've come to that conclusion and why I do it, for me ethically it makes sense, because remember my background was that I've grown up in the pharmacy world. And growing up in that pharmacy, as a kid, I'd often see patients coming in who would buy a packet of paracetamol. A packet of paracetamol costs 30 pence for 32 tablets. It's cheap, right? It's only 30 pence. And so when I started working, and a lot of chiropractors or osteopaths work privately, there is some availability on the NHS. It's difficult, but it is possible in certain areas. However, vastly in the UK, you'll find they're private. And when you're charging somebody 40, 45, 50 pounds for a visit, I've got to think, well, what's different between a packet of 30 paracetamol and a visit with us? If that goal of that patient is that they only want pain relief, I tell them this is not the place for you. Because why waste your money and time? I can't just give you just pain relief because I can't justify my fee. But if you want true health, and when I say health, આપણે just વિચાર કરીએ કે health નો આપણે word જોઈએ.
Might be difficult for people to see.
Oh, is it? Okay. Yeah. Let's think about the word health, right? How do you spell health? Health. Health is spelled Health. So we're looking for health. We're not looking at sick care, we're looking at health care. But the first four letters of health are heal. Heal. So my definition that I tell all of my patients and my team here is the measure of health is by how your body can heal. If your body can heal well, then your health is high. That's different to taking painkillers. So that is my first thing, is thinking about, for Avnish, diagnosis. Secondly, thinking about the philosophy of the chiropractor, having an open conversation with your chiropractor. They're obviously very good because you go to them for so long, for 29 years. So you clearly respect them. They must be amazing.
He's actually just written that for 2 years he did monthly maintenance with his chiropractor.
Fantastic. So the latest research that I've read shows that you can have maintenance visits anywhere between once a week to once a month, and a variety of whatever it might be. And that might change depending on what you're doing. So I myself have, because I'm very fortunate, I work in this field, I've got my colleagues here in my team, I get maintenance 2 or 3 times a week. 2 or 3 times a week. Now I'm very fortunate for that. My family, my loved ones, they all get maintenance 2 or 3 times a week. Our team here get adjusted 2 or 3 times a week. We get a massage once or twice. You see Cole's putting her hand up. She gets adjusted. She just had an adjustment and 2 massages today, would you believe? Cole had 1 adjustment and 2 massages today with our team. That's how we work because we believe in it. But what I'm saying is that at least somewhere between once a week to once a month. But if once a month wasn't enough, perhaps you need to be seen more frequently. The research is there. The research is just there. So just like when you go to your GP or you go to your dentist and they give you some medication or treatment, they have to be evidence-based. And we are the same. We have to show that there is evidence, there's research behind what we're doing. We can't just make it up and go, oh yeah, patient ne everything treat karo. It doesn't work like that. We have to look at the research and find what's going on. That's my secret sauce. I've given you my secret of how I get the best results. The secret is you look at the research, you apply the research, you monitor the results. If it's working, you do more of it, right? It's not hard, it's not rocket science. It's fairly straightforward in that respect.
So this is a good share and it's a good thing to open up as well.
Ooh,
so Guru has
excited.
asked, or he's written, because he wasn't entirely sure about what chiropractic was, so he googled it on Google. So from the NHS website he found the following, which is rather disturbing. There is a risk of more serious problems such as slip disc, stroke from spinal manipulation. So speak to a GP if you're unsure whether chiropractic is safe for you. And this page is reviewed in September 2020. And he wasn't sure what it was, so he's not to show doubt, but that's a good thing.
I want to first of all thank you so much for sharing this, and I'll tell you what, I have a problem with that, and a lot of my colleagues, a lot of my chiropractic colleagues have a problem with that definition. And the reason I have a problem with the definition, and I was talking to some people today about this, was actually, as a society, we've done a big disservice to GPs. And I feel really bad about this. What we have done is we've put a lot of pressure on GPs to give us answers that they cannot be incorrect about things they don't always know enough about. I know this because, as I haven't told you this, but I'm quite nerdy. So when I was studying in London for my osteopathic degree, down the road was Guy's campus from King's College, and I was friends with a lot of the medical students there. So in my spare time, I would sneak into their lectures, and I had lots of friends who are GPs, who are dentists, and they're really good friends of mine. I've got family who are GPs and stuff. I'm not bashing GPs at all. What I'm saying is I know they get this much information about what osteopaths and chiropractors do. This much, nothing. Okay, so if we are now told that we should go to a GP to get advice about something they don't know about, and their GP is now feeling pressure that I've got to give this patient advice and I can't be wrong because society has put me on a pedestal, that's a big problem. We shouldn't do that to GPs. What we should do is go, well, hang on a second, I've read this thing. Let me go speak to somebody in the profession. So thank you for bringing that question so I can share my answer to you, which is, like anything, there are risks and benefits. You take a paracetamol, you take a painkiller, there's a 1 in 4,000 chance of dying. There's a 1 in 4,000 chance of dying. Yet, we're okay with doing that. You know, you would not cross the road blindly, would you? You'd always look both ways to make sure that you can cross. But you know there's a risk of being run over. The research, right, that's where we're going to this. The research says with any type of treatment in terms of physical therapy, there is a risk of any problem in the range of 1 in 120,000 to 1 in 1.6 million. So first of all, I'm liking those odds because that's extremely rare. Second thing I'm going to give you is that osteopaths and chiropractors, I often joke with my patients who are worried about things. I say, listen, I'm not a ninja. I'm not going to sneak up behind you and do something that you don't want me to do, because I have to satisfy my regulatory bodies as a professional that I have received consent. તમે મને permission આપ્યું છે કે હું તમને treat કરી શકું. And it's not just any consent, it is informed consent, meaning મેં તમને બધું information આપ્યું છે, you had a chance to think about it and you have a decision to make. and you've decided which way you want to go, knowing the risks and the benefits. Just like leaflet if you start reading all the side effects, it can even happen just to one person, but if something's on there, then there's a chance of that happening. But also, let's look at more research, and I really went into a lot of research over the years. They have done studies on human cadavers, right? Like a research Kerochama. And what they've done with them is they've tried to generate a force on those cadavers to create and replicate the injuries that we're talking about. What they concluded in this research is the amount of force that was required to cause a problem was so much more than what we do in real life that it didn't, they threw that out. So it doesn't make sense. But then they said, hang on, that was on a dead tissue. What about on live tissue? So obviously we have ethics at play, so we couldn't do this on humans. But they took pigs and dogs because the anatomy in the neck and head area is very similar to humans. Dogs and pigs, they were doing this treatment, right? They were not able to cause them the problem that we were talking about. So now there's also a school of thought that says कि कोई ने stroke तातु होई, कि कोई ने disc problem कहता, right? They might already be having it, and they might happen to coincidentally go to a chiropractor or an osteopath. And they found that the incidence of it occurring when visiting an osteopathic chiropractor was the same as when you went to a GP who didn't touch you. So what I'm trying to say is that go to a professional who's on the register, make sure that they've done their due diligence, make sure you've found who you like, make sure they've done a case history, they've examined you, they've warned you about risks and benefits in your case, and then you go from there. Not one, over 15 years, I've seen thousands of patients. Not one of my patients has had a stroke or a disc bulge or disc herniation or fracture or anything like that. None of those risks have occurred. So you just got to, take that into consideration.
I was just responding to Dhiro, so he has apologized. He's just saying I wasn't trying to throw Trishul off the subject, but I think it's a really good question to ask.
I agree.
A lot of people have questions about this, so I think it's a great question. So.
No, absolutely. You haven't thrown me off. I'm grateful. I'm really passionate about this because I want to make sure that, we always hear the scary horror stories, right? But, the thing is that unfortunately every day there are patients who die on the theatre surgical table during surgery. It happens. One of the leading causes of death in the US is iatrogenic deaths. Iatrogenic deaths. Who knows? But say yes in the chat box if you know what iatrogenic deaths is. I won't get many. So why have you not heard about this? Iatrogenic deaths is a mistake made by the health professional. Right? So the thing is, then it doesn't mean that, okay, we never go to any health professional, we don't go to the doctor, we go to the GP, we don't go to any surgeon. We don't do that. You have to do everything with eyes wide open and ask the questions. You should in yourself feel, I'm happy to go forward. Remember? That's how we should do it. If you feel happy with getting a tattoo, then you should definitely get surgery. Don't get a tattoo necessarily if you honestly want to. That's up to you.
So I'm going to move on to some more personal questions that people have asked. So Jayshri Vora has asked, my son has damaged his disc while playing golf. The consultants have told him he will need surgery. What do you recommend?
Okay, so just like I mentioned, if your son is concerned about his discs, right? What my advice would be, surgery is not reversible. Whether it's a good or bad thing, you can't reverse it. It's very difficult, okay? So you must be confident that the surgery you're going to have is going to benefit. Now, let me just, first of all, I'm not trying to throw you off having surgery just for a moment. I want to make sure that you have exhausted all other possibilities before getting to surgery. And that's, I think, a smarter way of doing it. And so, first of all, if we are going to have surgery on the disc, just behind the disc is our spinal cord. And remember, the risks of this are higher with surgery than the risks of what we do as chiropractors and osteopaths. Then if you sever the spinal cord, there is a real risk of paralysis from that section down to the rest of the body. It's a small risk, but there's a risk. It's a real risk. And the risk is higher than getting treatment from a chiropractor or an osteopath. So first of all, my question would be, have you or has your son been to enough people who can make sure mechanically he is sound? Second thing, if he still has decided that surgery is the way forward, which is absolutely his right, I have found with my patients, those who have had treatment regularly with us before surgery have quicker, better outcomes from the surgery because their body is in a better state of working optimally, and they can bounce back and recover and have better, stronger rehab after the surgery. So it's not always an either or. I think sometimes it's a combination, but certainly the surgery thing is something we want to not run to. There's a famous saying, right? Okay, to the person with a hammer, everything looks like a nail. To a surgeon, everything, we think, okay, let's just cut everything open. But we should really be considering all the options. Ask the surgeon what they think about chiropractic or osteopathy, and they will tell you this, that, the other, because they don't know enough. So go to an osteopath or chiropractor first, maybe a physio. Just go by recommendation.
So the next few questions are sort of a running theme in terms of nerve pain or trapped nerve. So if I ask a few questions, then you can maybe do a
combined answer, sure.
Yeah, so Pravina has asked, I have trapped nerve in my spine and it's very painful, would like advice. Trishul, this is from Mukesh. Trishul, I've just recovered from sciatica and have been left with pins and needles in my right heel area. Should I accept this or does it need further attention? And Dina has written that she has sharp pain in her shoulder on the left-hand side, particularly when she extends her hand forward and she can't carry any weight. And Mahendra has also asked, lots of women get sciatica, so what exercise would you recommend? That might be a different question.
Okay, very quickly, the last one is a very quick answer. I do not recommend an exercise without finding the source of the problem, and also considering that what we want to give them when they give them the problem they had. So, exercise is such a broad topic, right? We can't just go willy-nilly, okay, lao YouTube per Joe, best exercise for this. Yeah, it might be best exercise for low back pain, but remember, that's a symptom. Best exercise for, was it sciatica, Komal? Last one.
Yeah, it was, yeah.
So remember, sciatica, but that's not a full diagnosis. What's the cause of the sciatica? Let's treat that first. And does it need exercise? Does it need something else? So I think we need much more information before we go down to what is the exercise for sciatica. It doesn't exist unless you know what the cause of the sciatica is. The other answers were, the other questions were?
Yeah, sorry. So Pravina has asked, I have trapped nerve in my spine and it's very painful.
Yeah, so trapped nerve in the spine, and also somebody else said they were left with tingling in their foot. The question is that I wouldn't settle for anything. I'm always constantly looking at how do we constantly keep improving things, and don't give up, but certainly keep searching for someone who can help you further. You'll be amazed at how much I've seen so many patients over the years where they've been told, I've been told no one can fix this. I said, well, maybe they can, maybe they can't. It's worth a go. It's worth a go giving it a shot and seeing if you can do if you can improve it just 5%, 10%, 20%, 50%, fingers crossed, 100%, any improvement is better than no improvement. The thing with nerves though is that it depends on what's caused the problem. So sometimes if you've had a proper sever, right, in nerve cell kapi gyu hoy na, there is a small amount of time for the nerves to regenerate depending on how severe that is. And so you have to look at that as well. So I'm going to try my best to answer your questions in that respect. However, the problem I have is that I don't have enough information. The depth I go into, the detail I get from my patients is so vast to find exactly about everything that they do. And that should really give you an idea that we don't need to be on the surface. We can't just go, we're very different people. So you must get someone to look at you specifically and your condition and how do we improve it? How do we make it better? So with regards to getting any kind of problem with a trapped nerve, again, we've got to find where is the trapped nerve, what's causing the trapped nerve, how can we resolve it, what's made you find it. Also, to the one that the person who said they've still got some pins and needles, the thing is, when you said you've had your trapped nerve resolved or sciatica resolved, but then it's not, is it? Because you've still got pins and needles, which is a symptom. So we've got to think about, how do you think it was resolved? What do we need to do to improve it further? Is there anything that we need to do any further? Again, I think some of my answers will end up being, you need to go book in, find someone who's an expert. If you're local to me, I'm happy to look after you. But if there's someone else you want to find closer to you, feel free. We have patients come to see us in Southeast London from Slough, from Essex, from Dagenham, from Sevenoaks, from Kingston, from all over. So, from Southgate. We have people travel to us 1 or 2 hours each way just to see us. So time or travel is not a challenge. I'm happy to look after anyone, but if that's a challenge for you, let me know. I'll find someone more local to you, more close to you, that I might recommend as well. Are you liking this format? Are you liking some questions? I'm happy to answer any more. If you've got some more, if it's useful to you.
I mean, these are very specific questions. So let's see what Jitu has written. Actually, this is a straightforward question. So at what stage or under what condition would you suggest using hot or cold compressors?
Fantastic question. Right, so first of all, we've got to think about, if you've got pain, if it's broadly speaking, I often will advise symptomatically to apply ice first, rather than taking a painkiller, because ice is natural. It's going to go to where you're feeling the pain. And there's two things that it really does. Often that pain, if it's due to a neuromusculoskeletal problem, if it's because of nerves, muscles and joints, there is inflammation there. So the ice will reduce the inflammation. So already it's starting to do something about the source of the pain. But second thing is, aap jare baraf nakhiye to ye akhu area numb thai jay, right? We can't feel it. And that's because there are nerves, they don't work very well at low temperatures. So it does two things. It, one, reduces some of the inflammation, but two, it actually does something about your comfort and reduces any pain. However, when do you then apply heat? Well, you apply heat when the only problem is muscle tension. And the thing is that muscles, they have two ways of getting into trouble. Either they can be a specific trauma, that can be like a muscle tear, or it could be gradually right? That might be just general muscle tension. It might be protecting or guarding something. Most of the time I see patients who are having muscle guarding because of something underlying that problem. So in that respect, muscle tension would be good to reduce it with some heat, but I would also then think about applying ice to get to the source of the problem as well. So you can do a combination. So we need to think about, okay, is the problem recent? But even actually, to be honest, now they've done research where after a long-term problem, we used to think ice wouldn't help, but actually now they're finding it does help. So you can still apply ice in most cases, I think, and you still get some benefit from it.
So would a yoga, this is sort of a sleep question from Thiru, would a yoga soft bolster under the neck be better than a pillow when you're sleeping?
Yeah, I think so. I sometimes sleep with no pillow, because if I'm sleeping on my back, I don't need any support. The back of your head doesn't need anything, because the back of your head is in line with your spine. If I show you on this model, right, the back of your spine is back here, it's in line with this. If I do a straight line here, you can see the space. The space that is created is just behind the neck. That's the only part that needs to be supported. So absolutely, sometimes all you need is a rolled up towel. You towel then roll up U-shape behind your head. That will support you back there too. So you can try that, rather than having a proper pillow that's holding you up.
So these are very specific questions. So can you treat prolapse? This is from Shushila Shah. Can you treat prolapse associated with severe incontinence and bowel? Sorry, my thing keeps popping up. With severe incontinence and bowel opening, even without constipation.
Well, okay. So one of the things that I will be very careful about is something called red flags. Any clinician will tell you about red flags, and the first thing જ્યારે પેશન્ટ પહેલી વાર આવે અમારી પાસે, we ask them questions, right? And what I'm looking at is red flags. Our patient પાસે red flags છે કે નથી? And what a red flag is something that requires an emergency situation. કોઈ દિવસ તમને back pain થયું હોય, and if you've got incontinence, bowel or bladder incontinence, do not go and waste time going anywhere else except for the emergency, accident emergency. Go straight there. Call 999, get there straight away. Because if you leave that too long, you might be left with permanent bladder and bowel incontinence, which is, very dangerous. So make sure you do that without fail, right away. So it depends then. If you've done that, then it's a different question. But I just want to make sure that it's clear to everyone. Do not waste time. Go straight to A&E and go for that. Okay.
Can you treat cramps?
Absolutely, yeah. Cramps is often due to muscle tension, right? Muscle tension stage, like I described earlier. So what's causing it? So there's two ways we can look at it. Either we look at, okay, cramp reduce kari sakya, that's fine, it's symptomatic, right? We can reduce the muscle tension in that. But secondly, my question is, but ni cramp kem thiyu pehla? What was the reason for it? And then we find that, and then we resolve that. Could it be because the body is not functioning correctly, so it's overworking the area? Is it because that person is not hydrated enough, so we need to make sure that they hydrate regularly? Is it because they haven't had enough solutes and things as well, so we need to make sure they have that too, and electrolytes and things? So we've got to make sure they have the right things. It's always about the source of the problem, right? It's not rocket science. We've got to really think, rather than being on the surface, okay, it doesn't hurt anymore. That's such a basic question for all of us. We're the most advanced human beings on the face of this planet in the history of the planet. We've got to stop thinking like, oh, dukeche matigyu. We've got to think about how is it the optimum? How is it functioning better? All of us on this course should be living way past 100. Easily. So if you're sitting here as a 50, 60-year-old, you're halfway through your life. You've got to double it. So you've got to look after your body. Got a long way to go. Don't take it for granted. Keep going. You should be bouncing around like a 6-year-old. So if you've got grandkids and you're like, oh, it hurts to play with my grandkids on the floor, go get it sorted out. Give them the run for their money, the 6-year-olds, 5-year-olds.
Sorry, just gone off. So the other question was from Harrison. What is the best treatment? It's going again to conditions, but what is the best treatment for cervical spondylosis?
Okay, so cervical spondylosis is a very good question. If you remember the image I showed earlier, which was where you had the thinning of the discs, this is what spondylosis is, the thinning of the discs. So let's look at mechanically, right? We're thinking mechanics. Our discs to a thin thigh, then you're getting reduction in the space for the nerves. So sometimes we have spondylosis without realizing it. And it depends on how much of that reduction is causing an effect in certain areas. Treatment-wise, you want to think about finding some level of traction, so physically taking that pressure off. Again, osteopathic chiropractors, we do this. It's a very straightforward way of doing it. Second thing though, on this side, if you don't know if you can see, but this particular spinal model, I've got lots of colorful dots on here. This represents lots of muscle attachments. So one thing you want to look at is how tense are those muscles, because that's going to be constricting that. No matter how much traction you try and put through there, you want to reduce that tension through there. One of the common reasons we get tension through the neck muscles is because we're not breathing properly. So all of you right now are relaxed. All of you are doing something called quiet breathing. After quiet breathing kariye, we're using only one muscle if we're doing it correctly, which is the diaphragm in our abdomen. Okay, so breathing like this, not like this. If we're breathing like this, we're using our secondary muscles of respiration. These muscles are useful when we need extra air in our lungs. But one other thing I want to tell you about, the nerves that go to the diaphragm here come from the neck. There's 3 nerves, C3, 4 and 5, keep the diaphragm alive. C3, 4 and 5 keep the diaphragm alive. So when I treat somebody's neck, to answer Harrison's question, you can see how this really affects all parts of their health. Because now it's not just about taking the pressure off the spondylosis, off the disc, taking rid of the tension, getting the nerve supply to the diaphragm, getting that functioning better. Also, by the way, upper heart chair, and you've got your diaphragm right underneath it, okay, the heart has a small tendon at the base of it that attaches to the diaphragm. If your diaphragm is working well and it's bringing the heart down, the heart, if you think of it like a bag, like a water balloon, it's stretching a bit. So it just takes a little bit of pressure, a little bit of tension of the cardiovascular system. But these things have to be done as a habit. We have to do it over a long period of time. It's not a quick fix, right? We're here for 1.5 centuries, right? We've all promised ourselves now we're living till 150. So you've got a long-term thing. You've got to look after yourself in that respect. Breathe correctly, optimally. Take the tension away from all these things. A lot of you right now on your devices are like this. It's all tensed up. You're putting compression through there. So your heart has more pressure. Your neck is more congested. Whereas you've got to open it all up. You've got to be in a much better position. And it should feel natural. It shouldn't feel hard work. So everything needs to change.
Shishila has asked, again, like an actual condition, can you treat Morton's neuroma in the feet, which involves like a thickening of the tissue around the nerves? Yeah.
So look, these are good questions. Now I want to be clear. The thing is that, again, I'm not going to get into the noisy stuff about how the legalities of this works, about what we can say and can't say, about what we can and can't treat. What I can say with a lot of confidence is every single patient I've treated, the way that I've had the best results is just for a moment I've parked aside any diagnosis they've come in with, and I've looked for where in their body is their body not working properly. And when we've gone through a process where we've taken away any inefficiencies of movement or function, and you restore normal health function through there, the body is always looking for a state to heal itself. It's trying to find a way to be best at itself, right? So it will do that. It will go back to a state of healing. But you have to give it the opportunity to do that. And sometimes the reason people get into all these sorts of trouble is because they have conflict within themselves. They don't realize, and their body's trying to find a way out, and it gets stuck, and it gets into this vicious cycle, and it can't find a way out. So what I do is I go in there, I break that cycle up. And so I'm not going to say necessarily I'm going to treat this or that condition. I don't do that. I look after people. I make that person a better version of themselves, whatever that might be.
Hina's question is, if she is looking ahead, she can turn her head fully to the right, but not so much to the left.
Okay.
That's all the information.
That's all the information. I'm guessing what you're trying to say is, how can you get your head turning more to the left? Well, what's stopping you turning to the left? Well, let's think about it. Very simplistically, it could be you've got some hard bone growth, for example, for whatever reason, which is unusual but could happen. You could have some sort of spasm in the muscles. Why has that happened? You could have, just off the top of my head, I'm trying to think of what else. I mean, it could be a number of different things, really. Has it become something that's sudden? Is it something that's been there for a long time? Is it because you did something specific and you now notice it? Now, in some cases, by the way, what gets really interesting, when I've treated some patients in their adult years, and we've gotten to know each other very well, in cases like that, sometimes you find out actually they happen to have a very difficult childhood, and on the left hand side of their body would be somebody, we're creatures of habit, right? We will sit in the same chair. And so sometimes everybody around the table might be sat in the same chair. So they might not have had a great relationship with somebody who sat to the left of them. Possibly that might have happened, or maybe in the office, in some sort of work environment, something happened to the left of them. Maybe some trauma happened that they're trying to ignore. So their body has gone into this survival mode now, where it's avoiding anything because it's got a history, it's remembered in the nervous system. We don't want to go that way, that's dangerous. So you can see that it's not so easy to I exercise It's much more than that. When you really look at it, there's so much more that goes on in our bodies. We're so complex, which is fascinating. I think it's quite exciting. But it's also finding what the reason that your body doesn't turn, your head doesn't turn to the left as much as it does to the right. That's what we've got to do.
Usha has asked, what causes curvature in the spine?
Okay, so I'm going to call you out, Usha. The thing is that curvature in the spine is not a bad thing depending on what curves you're talking about. There are some good curves and not so good curves. Then you've got the question of, are the curves that you have in your body the best curves for you? Before I go into the curves, let me just say this. If I was to treat some professional athletes, somebody like Tiger Woods, who's a golfer, or somebody like Rafael Nadal, who's a tennis player. Rafael Nadal is an example I use quite often. In his left arm chene, he's got such strong muscles in his left arm, and in right arm, he hasn't got as much strong muscles at all, because he's a left-handed tennis player. He's really powerful there. If he came to see me as a patient, first of all, I'm not going to balance him out, because eno function such hai कि he needs the left side stronger than the right. That's beneficial to him. The first and foremost, we look at patients and go, right, what is this person doing, and how can I make sure that their function is in line with their structure of their body? Now, let's go back to the spine and remind ourselves what curves are normal and then what are abnormal. So if you look at the spine from the side, okay, let's start from the neck. In the neck, we've got this backward curve. This curve is called a lordosis with an L, lordosis. The one in the middle part of the back is called a kyphosis when it goes forward, a kyphosis. And in the lower back, you've got a lordosis again, a backward curve. These are normal healthy curves. And what these do is they strengthen the spine. Arch bridge ma, the arch creates strength to the bridge. Right? When you have a bridge over a river, the bridge is stronger because of the arch. That's what these curves do. The ones, Usha, I think you're asking about are curvatures looking at the spine from the back. And you can see my spine here is a little bit worked on, so it's quite wobbly. And these curves, if you're bending to the side, this is called a scoliosis. A scoliosis. It can be as slight as this, it can be quite severe. I have not come across anyone at all who does not have a degree of scoliosis. It's, either slight or severe. Now, what I'm going to do is just share with you an image of what a scoliosis can look like and how it can affect people, which is this. See, this is on the left, you've got an image of a nice straight spine. On the right, you've got that scoliosis. And the problem there is because the ribs are now also curved, it's going to start crushing those organs. And in severe cases, what happens is you have to have deep surgery where you have to straighten it out with metal rods in the spine. We're talking about avoiding surgery. Well, this is, it's quite severe stuff. So this is why I always say that make sure that right from an early age, we check out our children, make sure that they're developing well. We see babies right from the youngest patient I've ever had is a 2-day-old baby who came in straight away because they were advised to by their midwife actually. And they've done very, very well over the years. I still see her running around like a lovely 9-year-old, I think she is now, in the streets locally. So the point I'm making here is if you imagine on this particular image, the person on the right, there's a good chance they would like wearing a bag on their left shoulder. And their spine, if it's going to, as a child, is going to develop, it's going to develop in this curve, isn't it? So this is what we want to avoid. We don't need this, really,
Did you tell them about the face scoliosis?
No, I haven't. Actually, this is what happened with the 2-day-old baby. The problem happened was she had a scoliosis in her face as a 2-day-old baby. And the problem happened was that at that young age, the baby needs to feed and breathe, right? And the baby couldn't do that because her jaw was off and her breathing was off because her nasal passages were strained and stressed. So what I did with every patient, which is I found what we need to optimize in that patient. 2-day-old baby chair, right? Bear in mind, she's 2 days, right? And I started treating her. Now, the advantage of treating babies that young than adults is that baby doesn't care. Oh, manas pase awanu, ketla bagi jawanu, keto kharcho tase. They don't think about any of those things. They're just lying there at that age. So it's very quick to get the results. And thank God they did that, because that baby, if they hadn't had treatment, I wonder, I don't know, but the question I have is, if their jaw is off to the side like this and they talk like this, like every time bole, and then like on pachi school jai, teacher ne thai ki chokri ne chhe and it's like na lesson not karti enough. So she gets put into a lower class. In lower class Majai, so she doesn't get good marks and she doesn't get the respect that she deserves. Maybe she doesn't get the career that she deserves. Maybe all those things happen. I don't know. It's a question I always ask myself. What if this versus this? But instead that didn't happen. What actually happened, she's got a nice straight structure. She could feed well, so she was putting on weight correctly because she needs to do that as a baby. She was breathing well, so she wasn't having laboured breathing. And she's developed, like I said, into a lovely little girl. And in fact, what happened with her, because this was their first time baby, the parents then came in because they were so impressed with what happened to their child. They said, I can't believe I don't know about this. So they themselves came in for treatment. And then they became pregnant the second time. Without a shadow of doubt, they brought their second baby in. I said, listen, Trishul, just got to look after my family because I know we want to make sure they get the best care they need. So share that around. You just don't know who you can help, what lives you can affect. It's amazing.
I know that time is now pressing, so I'm going to do maybe 2 more questions.
Sure.
So Dina has asked, I have osteopenia. Sorry, am I saying that right?
Osteopenia, yeah.
Osteopenia. I think I spelled it incorrectly. But my height is decreasing day by day. And she's also written that her spine is twisted to one side.
Okay, so I'm so sorry to hear that, Dina, right? Is it
Yes.
Dina? Okay, so Dina, listen, osteopenia, okay, is not the end of the world, first of all. For those of you who don't know, normal bone growth ayache, the first stage is osteopenia, પછી osteoporosis થાય. હવે આમાં શું છે કે આપણું બોનનું સ્ટ્રેન્થ રિડ્યુસ થઈ ગયું હોય. હવે પહેલાં આપણને થયું કે osteoporosis એકવાર થઈ જાય એટલે બસ is permanent. However, we know the latest research shows કે આપણે reverse કરી શકીએ. એટલે Dina, you're in the middle, right? You're not full-blown osteoporosis yet, which is great news in that we can more easily reverse this. So you've got to do all the right things. You've got to first of all check, are you absorbing calcium correctly? Are you getting a good source of calcium? Is it getting into your bones to strengthen that? Secondly, are your bones getting the excuse to strengthen? And what I mean by that is we have to exercise them. We have to give them stress. When you give them stress, then they get stronger. In your case, especially in the spine, we want to think about what is going to load that up. So we need to really think about what's happening with that and also correcting up some of these curvatures to see whether we need to correct them or whether they're normal for you and how we can then make sure that they optimize for your function. So there is stuff that you can do. Don't lose hope. Make sure you exhaust all the options. Feel free to message me and I'll happy to guide you. But certainly there's some work to be done and it's possible.
And I've got the final question.
Final question for this evening. I hope it's been useful.
I've answered everyone's questions. If I haven't, then please do pop in the chat box. But yeah, I hope I've answered everyone's. So Suresh has asked, is hunchback hereditary?
Possibly. Final question on your small one. Okay, so here's the thing. What we hunchback, right? So going to posterior, it can be. However, the other thing what we don't know or we are starting to think is hereditary versus if we're just copying our parents. You know, they look at us all the time and they mimic everything that we do. So this is even more reason why you must look after yourself to ensure that your children and your children's children don't have things. So if that keeps happening generationally, is it hereditary? Don't know. Let me answer your question in a slightly different way. They did this study, right? This is very interesting. I love this research they did. They took these rats. The rats, they give them a certain smell, like rose no smell aipo. And jare rose no smell aipo ne, like an electric shock aipo. They throw pain response thai. But they kept doing this to the point where they then only gave the smell, but they didn't give them a sharp or pain thing, but like our pain receptors lit up because they now associated the pain with the smell. So of course, now we understand that, right? However, let me tell you something. That first generation of rats then had children, so the second generation, right? With the second generation, the researchers took these rats. They did not give them the sharp pain response, but they gave them the same smell, and they measured what happened. they responded to the smell, the second generation responded to the smell the same way as the first generation did. But they never were pricked with the pain. But it gets more interesting. The researchers continued monitoring this to see how many generations this would go on for. And guess what? It carried on for 14 generations. એટલે meaning જે 14th generation ના જે rats હતા એ આખા last 13 generations they didn't receive any pain, but their response was with pain when they had the smell because they do પેલો generation હતું. The question is, was it hereditary? There's something going on there. We have to really be mindful. We know so much, and especially in our Indian culture, we have so much about the spirituality, about mindset, about meditation, about working on ourselves. There is so much more power to this than we know, and all the research, the science is now coming through, backing this up, which we've known for so long. And it's really interesting. So, long story short, is the hunchback hereditary? Well, how much of it is hereditary and how much of it is you adopting the posture of your parents? That's the question we've got to look at. And how much can we reverse it to meet your goal, meet your lifestyle?
I think that's it. We've had lots of people say thank you.
You're welcome. Thank you for having me. Thank you to my wife Komal for keeping me on track. She makes sure that I do what I'm meant to do and don't do what I'm not meant to do. So thank you, Komal, for that. Thank you all for being so active and participating, because I've really enjoyed it much more. I prefer interaction than just me talking at you, because I think it's more valuable to you. But listen, I'm not going away.
A lot of people have also asked your contact details. So I have
just about to give it to you.
Yeah, so I have put AVID Clinic. I have put our clinic details.
Yep.
I've got our phone number on there.
Yep.
Do you want to just explain about your socials as well?
Yeah, best thing, if most of you are on Facebook, please just look up Trishul Vadi. Just message me. Do go to Facebook Messenger, message me. Just I get a lot of messages, so please just tell me that you found me from this talk. So just jot my memory of where we've spoken or what I've told you, so they'll just give me a bit more context. But please utilize me. I'm honestly meaning it. Just ask me. I'm happy to help in any which way I can. Even after this, if you think, just please ask me, or even via the council here, and the moderators here, please feel free to get in touch with them, and they've got my contact details, and I'm happy to speak with anyone, help you any which way I can, because that's my whole purpose. My purpose is that for the last 15 years, I've been obsessed with trying to make sure that we can change lives for the better, and we've done such a great job of this. The whole reason why I'm here spending time with you this evening is so I can make an impact to you as well. And I'll be back here at 7:30 tomorrow morning treating my patients. So I'm very happy to be here late this evening, because I'm here making an impact already. Might just have a sleep here actually, to be fair. It looks quite comforting, right? Might just want to go home. But anyway, thank you so much for being so active, and I really appreciate it. And I hope you found it useful. And if you ever want me to come back, I'll be more than welcome to come and enjoy. But lastly, I should have told you about David. This is my skeleton. Please don't worry about him. He is armless. But anyway, that's a bad joke for you for this evening. But thank you again. And I'll go pass it on to Natubai, I think.
Hello. Jai Janendra and Jai Shri Krishna. અત્રે ઝૂમ દ્વારા સર્વે ઉપસ્થિત રહેલા તથા શ્રી નવનાથ વણિક એસોસિએશનના પ્રેસિડેન્ટ દિલીપભાઈ વિઠાણી, નવનાથ વડીલના પ્રેસિડેન્ટ નલિનભાઈ ઉદાણી, ઝૂમ ટીમના લીડર અરવિંદભાઈ મહેતા તથા સર્વને હૃદયપૂર્વકના જય જિનેન્દ્ર, જય શ્રી કૃષ્ણ અને પ્રણામ. મારું નામ છે શિરીષ વિઠાણી અને હું નવનાથ વડીલ મંડળના કમિટી મેમ્બર છું અને ટ્રેઝરરની સેવા આપું છું. આજની આ સાંજનો કાર્યક્રમ બેક એન્ડ નેક પેઇન ડૉક્ટર ત્રિશુલ વાડી એ ખૂબ જ સરસ રીતે માહિતી અને માર્ગદર્શન આપવા બદલ ડૉક્ટર ત્રિશુલ વાડી તથા બંને મોડરેટર કોમલ વાદી અને અનુપ મહેતાનો ખૂબ ખૂબ આભાર. અને તમારો આ કિંમતી સમય અમારા સમાજ માટે ફાળવવા બદલ અમે તમારા કામની ખૂબ જ કદર કરીએ છીએ. અને અત્યારના સમયમાં બધી જ રીતે કેમ હેલ્થી રહેવું આપણા બધા જ માટે ખૂબ જરૂરી છે. ભગવાન હંમેશા તમને આશીર્વાદ આપે એ અમારા બધાની શુભકામના. આવી સામાજિક અને સમાજ ઉપયોગી પ્રવૃત્તિઓ કરવા ઈશ્વર હંમેશા આપને શક્તિ આપે. આજનો આ સુંદર કાર્યક્રમ સફળતાપૂર્વક આયોજન કરવા માટે અને આપણા સુધી પહોંચાડવા માટે ઝૂમ ટીમનો જેટલો આભાર માનીએ એટલો ઓછો છે. અને આજની ઝૂમ ટીમના મેમ્બર હતા અરવિંદભાઈ મહેતા, જગદીશભાઈ સંઘવી, જગદીશભાઈ સંઘાણી, કિશોર બાટવિયા, નીતિન ચાવડિયા. આજના પ્રોગ્રામનું ફ્લાયર આપણા બંસીબેન રૂપાણીએ બનાવ્યું છે, તે બદલ બંસીબેનનો ખૂબ ખૂબ આભાર. બીજી બે અગત્યની જાહેરાત. પહેલી જાહેરાત, કાલે શનિવાર તારીખ 8મી મે સાંજના 8:30 થી 10 સુધી શામ સુહાની આઈ વિથ નારાયણ. અને બીજી જાહેરાત રવિવારે તારીખ 9મી મે સાંજના 8 PM એટલે સાંજના 8 વાગ્યાથી 9:30 સુધી વન જૈન વેબિનાર ઉપર લિવિંગ વેલ વિથ ડાયાબિટીસ ગુજરાતી. તો આ બંને પ્રોગ્રામમાં હાજરી આપવાનું ના ભૂલતા. તમારો સાથ તમારું બળ વધારે છે. શ્રી મીઠાણીના સાદર વંદન. જય જિનેન્દ્ર, જય શ્રી કૃષ્ણ અને શુભ રાત્રિ.